After 2 years in restraints, her arms no longer moved. The joints had fused in position, crossed at the wrists, exactly where the straps had held them. When the leather was finally removed, her body remained. It had learned its shape. Mechanical restraint was not punishment. It was procurement. State hospitals purchased restraint chairs by the dozen. Catalogs listed models by patient type. Medical suppliers offered bulk discounts. Doctors prescribed duration like dosage. Journals debated technique, not ethics. This was standard equipment. Doctors believed uncontrolled movement caused harm to patients, staff, and treatment. Stillness prevented injury. Control prevented escalation. A restrained patient was considered safer. A safer patient was considered improving. The straps were the treatment. Patients were secured to beds, chairs, and walls. Wrists, ankles, chest, forehead. Records noted start time and end time. They did not note screaming. They did not note begging. They did not note the moment a patient stopped responding. Patients who resisted were restrained tighter and restrained longer. The resistance itself became the diagnosis. One patient was restrained for observation. His wrists developed sores. The sores became infected. The infection entered his blood. He died on schedule. The chart noted correct application. Duration as prescribed. Technique is trained. The death was recorded as complication, not consequence. After weeks in restraints, patients changed. They stopped pulling against the straps. They stopped calling for help. They stopped meeting anyone's eyes. Staff called this improvement. Calmer, more manageable, less disruptive. No one asked what had been extinguished while the patient hung motionless. Restraints solved problems staff could not. One nurse could manage an entire ward if difficult patients were secured. Budgets were tight. Staffing was thin. The leather straps never called in sick. Administrators measured incident reports. Incident reports went down. That was enough. Restraints did not end with reform. They ended with photographs. Journalists documented wards filled with strapped bodies. The images were published. The public was disturbed. Hospitals revised their policies. Not because the practice was wrong, but because it had become visible. The straps were eventually removed. The chairs were stored. The catalogs were discontinued. Patients who lived in restraints did not return to how they were before. Some still held their arms crossed. Some flinched when touched at the wrist. Some could not sleep unless something pressed against their chest. The restraints were gone. But the shape of them remained.